So we're here unsupervised. We could get into a lot of trouble. It's really nice to see you again.
Likewise,
good to see you after the lovely visit you arranged in Boston. And we're supposed to talk about policy and mental health, addiction, and you said something at the Kennedy Forum's event about a month and a half ago that has really stayed with me. And you pointed out that the last law that President Kennedy signed was the Community Mental Health Act, which is 60 years old this month.
That's right.
And that was, an effort to transform how our country responds to people who have mental health problems and people who have addictions. And when you look back on it now, what do you think of that? I mean, there was clearly very high hopes. Do you feel they were realized or not?
Well, all of this comes down to the money, like everything else. And that was proposing a whole new approach to paying for care that was community-based rather than institutional-based. That never followed through. President Kennedy was assassinated shortly after, and when they did Medicaid and Medicare in '65, there wasn't the funding because addiction was seen as behavioral, whereas people with cognitive challenges were covered. And if you look at the system of care for people with intellectual disabilities, you can see what happens when you're in the stream of dollars. And if there's one thing we can do to change the current status, we've got to open up a new way to pay for the services that are necessary, because the current model, both on the public and private side, is not going to be sufficient to meet the need. And you're hearing about great science here. The challenge is we want to make that science available to everybody, because otherwise it's not doing a whole lot of good outside the people who can afford to get that kind of help.
Yeah, my reaction to it is exactly the same. And one other difference was, of course, there was a very well-organized advocacy group for adults with intellectual disabilities. It was called ARC at the time, a term we don't use anymore, retarded, but it stood for Association of Retarded Citizens. And those were parents whose kids were in these horrible institutions and were able to pressure the Congress, pressure the White House to follow through. And the life of a person with intellectual disabilities is just dramatically better in the United States today. I mean, living in the community usually, much happier, physically safer. And I think it's also been good for everybody else of living alongside and going to school together, makes us less stigmatized and less prejudicial. But nobody was advocating for people who were addicted.
That's right.
I mean, they were probably in those institutions because nobody wanted them, or people were mad at them, or their families were sick of them. And that's really been, it seems through my career now, doing this for 35 years, a real challenge to try to get a compassionate response to addiction, in part, understandably, because so many people have been hurt by someone's addiction, so they're angry, which I get, totally. But it's a different dynamic that creates a different political dynamic that we have to deal with.
Yeah, no, absolutely. So the key to unlocking all of this is building an advocacy movement. So you've got all these brilliant scientists, and we've made such great advances in neuroscience and practice-based research. But until we have that same advocacy, and by the way, we're, like The Godfather, we're bigger than U.S. Steel. Like, we are the biggest special interest group out there, but we're not applying ourselves. My wife ran for Congress 4 years ago, and obviously I know everybody in mental health, but I couldn't organize rallies because there's no universal lists of everybody who works in the field. There's no real advocacy lists. I can't get a list for the psychiatrists, the psychologists, the social workers, the marriage and family counselors. I can't get the list of inpatient folks who are working in that space, outpatient folks, and certainly I can't get lists of consumers, their families, people who've families have survived a loved one who's taken their life, overdose. I mean, you start adding all this up, you have tomorrow a whole new funding system for mental health and addiction if those people voted, but not just voted, but self-identified as voting for a candidate because of that candidate's position about transforming the system. And that's entirely doable, but it's going to take money. And a lot of philanthropy understandably funds different programs and stuff like that. But where we don't have philanthropy is in advocacy. And if you want to get all these good programs implemented, you got to start from the policy end, because moving the needle on some of these reimbursements, the payment formulas, allowing for pooled dollars that include both public and private to pay for things that insurance companies won't pay for because they don't turn the ROI around in the 5 years as opposed to the quarter, which is what most insurance companies rely on. So we have to fundamentally change the reimbursement system so that we invest in the kind of things that we know have huge payoffs, but because those payoffs are downstream, we can't capture that ROI. So in Rhode Island, when I was in the state legislature there, we got all the insurance companies to pitch in to a prevention program. It was really small, but it was kind of a pilot. But the idea was all of them paid in the percentage of what their market share was in Rhode Island. So none of them were at a competitive disadvantage vis-a-vis the other payers. And then they all liked it because they got to pay for the evidence-based interventions that everyone knows works, but they can't justify in their balance sheet. So we have to come up with something similar because the current system is rigged against us. We can have all the best ideas, and you're head of the policy translation because it's not enough just to have good science. You've got to be able to implement that. And there's a science to political science.
Yes. Yeah.
We've got to deploy that. And we have to make sure that philanthropists have this on their radar as an area to make a difference. It's not as sexy as giving to these terrific programs that are working in the community to do X, Y, and Z. But if you don't unleash the current funding mechanisms to support this, you can do all the philanthropy you want. It's never going to be enough to meet the societal changes that are going to be necessary. So
I mean, at least part of that to happen requires people to be willing to be publicly identified with addiction.
Yeah.
And I've noticed, I'm very fortunate. I have an endowed chair endowed by a dear friend of mine, George Ting, in tribute to his daughter, and he wanted his family name on it. Most of the gifts that are made to addiction research around the U.S. up to that point, people wouldn't have their name on them. They would say, here, you can do it. No, don't identify me with that. And I've noticed it's just started that there are more sort of things with people, the Graken Center, like I want to be associated with it. But that is a rare person.
Yep.
And if you don't, at the risk of being a bit personal, I've wondered how you have negotiated that. When you and I met maybe about 15 years ago, as you described so movingly in that terrific book you wrote, you were struggling. And your life has turned around fantastically to joy to all of us who know you to see that.
Thank you.
And you've taken this big risk now, like you're going to put your name next to addiction, a terrifying word to most people, kind of word that parents are afraid of and all that. How did you make that decision? Was that a hard decision to do?
Well, first of all, I didn't make the decision. It was made for me. I went to rehab at first time, 17, and the fellow that I was in roommates with, when I was running for office, sold the story about being in rehab with Kennedy to the National Enquirer, and there was a picture of him and a picture of me, and I thought was going to kill my early stage part of my career for good, but I represented a terrific neighborhood, heavily Italian American, and the only thing they hated more than drug addicts were people who ratted on drug addicts. So my next re-election was vote for Pat, not the rat, and it was a successful thing. So when I got to Washington, I could sign on to the mental health parity because all of my colleagues were apprehensive. If they put their name first, everyone's going to ask them, well, do you have a mental health in your family? Do you have a addiction? And none of them want to go down that rabbit hole because then there's going to be 35 more questions about their family or their recovery or what have you. I knew a ton of my colleagues who were struggling.
Sure.
And the only reason I knew is because they knew I was one of them. But they never came out. So I met with a lot of them, and I can tell you if the country knew them, there may have been a different feeling towards it. But like you said, I had one of my colleagues tell me this horrifying story about his own family and then voted against the Parity Law.
Yeah.
And I went up to him afterwards and I said, how could you vote against this? We talked about it. He said, Patrick, I come from a different part of the country. I come from the buckle of the Bible Belt. And in our part of the country, they still see these illnesses as character flaws, not chemistry issues, as you've just heard. And that's still a major challenge. But it's changing. So I have a book coming out in May, and I'm going to put a QR code in the back. I have an organization called Don'tDenyMe.org, and I collect stories around the country of people who feel they've been denied care wrongfully under the Federal Mental Health Parity and Addiction Equity Act. And my hope is that if I can pump up the numbers of people who are willing to tell their stories about denials, pre-auth, retroactive review, concurrent review, all that stuff that payers use to manage you out of care rather than manage your care, then I think I can take it to AGs in the states or insurance commissioners and say, look at all these people, they're from your state, they've reported these denials, and by the way, we've got the Millman report that shows that there's huge disparities in access already. So it's not like if you add some personal stories, they fit with the underlying narrative of denial, but they need real people to go to the AG's office. And I can guarantee you in this political environment, AGs all want to be governors. And if you tell them, here's your chance to stand up for your constituents in a very big power block, and voting block, I think they'll do it. Mm-hmm. And that will change the dynamics.
You're reminding me of something people who don't follow politics closely are often shocked by, so I'll just share this. So for some people, it seems strange. How can we still have these problems with people being denied access to mental health addiction when we have this terrific parity law? So here's the thing that's never in the movies about how politics works. Once the law passed, that's not the end of the fight, that's the beginning. And then there are regulations. And I joined the Obama administration. I worked on parity. I worked with you. I had the honor of working with your dad. That passed. We came in. You would not believe the intensity with which the insurance industry fought all the rule writing for the. I'm pretty sure it's correct. There was never a longer gap between the law and the regulations in the history of our country, and a lot of the advocates have gone home. And it's now all lawyers who work for the industry and create these incredibly complex, convoluted things. And now imagine you're a family in crisis. You got to figure out all that, and then are you supposed to wade through the code of federal regulations and figure out, well, was my son allowed to see this care? I can't tell you. I'm not a Blue Cross executive and all that sort of thing. And so we lost a lot of momentum after the win of parity, in the regulations. And the only other way really I see in American life to fix this is the same as you, which is comes through the courts. People willing to, take these cases on, and sometimes we need sort of socially justice-oriented attorneys to do that, but also families willing to stand up and tell their story in open court about what happened to them. Right. And I find when that happens, the results are usually very positive. I mean, New York did very well, with a number of the companies. Yep. And so there's certainly possibilities there.
No, there's huge opportunities. But I can tell you, if I can get 100 people outside of any major Fortune 500 company and do a literature, educational picket. So every employee going into this building says, you have United Healthcare. United Healthcare under the Northern California Circuit Court was demonstrated to substitute their proprietary medical management criteria for those generally accepted standards upon which you're supposed to make decisions on the level of care, whether people get care or not. They just ignored. If that were cancer or heart disease, they'd be locked up.
People would go crazy.
So, but I guarantee what would change things is if these Fortune 500 companies got all their employees asking, well, wait a second, my family needs this, and why am I not going to, you're picking this payer that's got these clearly huge violations, and why they're even allowed to sell insurance. I mean, that's a privilege, not a right, when they're so blatantly violating federal and state law. But what you say is right. Unless you have the families there and the people putting pressure, it's not going to happen. Because, as Frederick Douglass said, power concedes nothing without demand. It never has and never will. And until we ratchet the pressure up, it's not going to happen. So this has to be a political movement. We've got to find our Me Too moment where families wake up and say this can no longer be tolerated. Maybe it's one of these big purchasers in a big Fortune 500 self-insure plan who's got a family issue and says, wait a second, this is outrageous. Anyway.
Something else about Parity which struck me. So I have a photo of the bill signing, and
Yeah.
you're in it, and you and your father, and the President George W. Bush, and Pete Domenici, and Jim, our dear late friend Jim Ramstad. And you look at it and think, like, how could these people even talk to each other? Pete is this, very, very conservative, cut the taxes, state's too big. Jim, kind of a liberal Republican. You and your dad sort of liberals, and George W. Bush quite conservative. But there was the unifying thread. Every single person in that picture had been touched by this issue, and that overcame the incredible polarization, which has only gotten worse. Do you see any prospect for that now, 15 years later, that those personal ties, that these are not Democrat and Republican issues by any means, can overcome the situation we have now with our politics in this country?
Yeah. Well, I think this is a winning issue on a bipartisan basis. As I said, my wife ran for Congress. We roundly attacked for progressive politics and being Democrats in a very conservative district. It was held by a Republican. When my book came out, I was invited to speak at my Catholic church. I was denied communion in Rhode Island for being pro-choice and gay rights, but I was asked. They clearly didn't look at the clippings, right? So they invited me to speak, and packed house. The head of the choir, it plays for the Lambs of God. They're the group that goes out in front of the clinics and protests. She came up to me 2 months later and said, my son's in crisis. I don't know what I'm going to do. Can you help me? And one of my neighbors runs the Atlantic Care Hospital. I called her up. I said, can you get him in? Absolutely, because timing is of the essence, as you know, people want it in crisis. We got him in. I called another neighbor of mine, friend from the Cape, actually, who owns a bunch of these treatment centers. I said, can you scholarship him? Yeah. The guy so fast forward 5 years, I'm baptizing my baby, and they're there with their son who was in crisis. He's 5 years sober. He is baptizing his baby, and she comes up to me with tears in her eyes and said, whatever I can do for you. And it's not as if she didn't know my politics. It's not as if she, and I go, the Fox invites me on occasionally because I'm against commercialized marijuana, and they love getting a Democrat to say that they're against marijuana. I'm for decrim. I just can't stand addiction for profit industries. And our public health and everything we're talking about here, it's not going to happen when we are addicting our kids with social media. We're priming their brains for addiction. The dopamine nation, one of your professors here at Stanford wrote that. And then you've got for-profit pushing this stuff in every community. 13 times more likely to have liquor stores and pot shops in black neighborhoods than white neighborhoods. They're totally targeting a vulnerable population because what do we know about kids today? Anxious, anxious, anxious. So if they're anything like me and they've got a propensity because it runs in my family of addiction, boom, you take this and you're off to the races because of that, physical manifestation of addiction followed by the mental obsession, the spiritual malady. So
I see that. I want to just because we're almost out of time. I do want to say something about tech. We have all this tech, brilliance in the room, and I agree with you completely. There can be a dark side to this pushing addiction. There are now gambling sites that literally will track people who are trying to quit gambling and send them a note saying, "Hey, you're in Ohio. Did you know there's a football match? Do you want to play some?"
Totally.
That's the dark side of tech. However, could be upsides for tech, and maybe we should close about that. So. This problem cannot be solved just by the public sector. And I'll just give you like a simple number for that. Let's say you want to develop a medication to help people with alcohol use disorder. To take a medication in the United States from molecule through the FDA process costs about $1 billion on average. The entire budget of the National Institute on Alcohol Abuse and Alcoholism is $600 million. So new medications will come from the private sector or they will not come. Ditto a lot of the other technologies. And there is a huge role for this. I mean, I was just in Britain. I saw a company that has a device that someone who's addicted to opioids can wear that measures their breathing, and if it shows that they go into overdose and they pass out and they're alone, will ring 911 to save their life. I mean, that's the kind of incredible thing we can do with this tech. And so, you know, the fact that there's a dark side doesn't mean there can't be an upside. I assume you would share that judgment.
You know, the gambling thing is going to be a monster as well. The association of people with gambling addiction and suicide is really strong. And as you said, you know, we're just pushing. You can't watch the TV and not have 15 ads in any given hour. But on the gambling, so, you know, one of the best evidence-based interventions for addiction is contingency management. Never really, and it's about paying for recovery, rewarding people for staying sober. Obviously, gambling is like they use the principles of gambling to hit people with a little dopamine, like you are now eligible because you went to your therapy, you've taken your meds, you've gone to your AA meeting, and now, boom, you got the gift card here, or you're earning X number of points. And then, as you know, there's like debit accounts where families who are like pulling their hair out, I don't know what to do with my kid because they're living in the basement, they're smoking pot all the time, they're taking drugs. And you say, well, we'll pay for housing, you know, or the debit card can be tied to just paying for those things where they aren't able to use it for drugs and alcohol. I mean, there's so many opportunities for innovation. And I agree with you. The biggest thing with mental health and addiction is getting those biomarkers. And now with remote sensing, we can get biomarkers on how people are doing. So it's not every 2 weeks you go to your psychiatrist, you do your med management, and you can't tell how the person's doing in between. This is an ongoing daily reprieve, right, that we get when we're in recovery. You can't let that. You got to be on this all the time. And the nice thing with technology is it can help signal when your therapist should be calling you, when your folks that are, you know, your peers in recovery should be reaching out. That's a game changer.
Absolutely.
Game changer. And that's all facilitated by technology.
Yeah, absolutely. That's a great note to end on, man. Nice to see you.
Thank you, Keith, for all you do.
So we have an award that we give every year, and this is our second year. And this year we want to give you our Mental Health Care Innovations Mentee Award to both of you, because we couldn't, you know, we just felt like you two.
It was really for Keith, and I happened to be sitting on the stage.
I was thinking the same thing.
Well, the two of you together have both been innovating in mental health care policy and, you know, leading to actual translation and implementation of policy that can expand access for mental health care, for addiction, for prisoners, et cetera. And so for that, we want to give you the Mental Health Care Innovations Award for your work in policy and translation.
I'm very grateful.
Thank you.
I want to point out Garen Staglin and Brandon Staglin, head of One Mind for Research. When I was, they did a big fund. They were the only ones. There's a handful of people who would participate politically in addition to philanthropically, and they would do big events for me as I was reelected over and over because of their support. And I remember they had this big event for me, and it was just as I had to go back to treatment. And I got a big DWI, it was all over the papers, and I called Garen and I said, so sorry, I'm letting you down. He said, you go get help, and when you come back, the money's gonna be waiting for you. And that's Garen and Brandon, and if you don't know about One Mind, you should. They're doing all kinds of innovation in both mental health and addiction, funding great scientists, some of whom have been on this podium already today. and really organizing an advocacy movement, which I'm proud to be part of as well. And Keith really is the best. Like he is, he was the guy that everybody was wanting to put in ONDCP because he would really be great. And Keith goes, no, you do it. And I'm like, okay. But and someone else got the job. But serves us both right. But I'm honored. Thank you so much.
Yeah, thank you. Thank you.
Maybe do like a...
Thank you.